Now, that's what gets me in my questions. By the way, I'm not claiming copyright in this character, Tintin. I took a photo of a poster. Yeah, that would be criminal to claim I've invented this character. He's a Belgian creation, Hergé, and yes, now popularised in films as well as cartoons and books. So questions. Is there a single unifying concept of social capital? Well, if you read the social capital literature, you come across the same ideas again and again. You know, individual social capital, community social capital, this bonding and bridging, to some extent the cognitive and structural. You come across it again and again. When it comes to specific measures, way the most popular are things about trust, but not just that. And then there's all these questions about participating, voluntary participation, how many groups are you a member of, how often do you go to meetings, whether you're an office holder in these groups. So there's a sort of, the thing that's unified is, it's the same measures coming up again and again. Where my question mark is there some sort of concept that we're measuring? Or are we measuring lots of different things? That's one question. To what extent do these survey questions, possibly regarding people's beliefs or their behaviour, to what extent are they like to be a robust measure of social capital? Now, I do want to stress that sometimes these measures are simply being used as a snapshot over time, and the issue is, what direction are things going in? Is more trust about or less, and so on. Putnam, who's popularised a huge amount of this, had a very famous book called Bowling Alone. And the idea was his observation that, this is 10-pin bowling, his observation that bowling was very, very, very popular in the United States, but something had changed over time. And what had changed was it used to be bowling clubs, and people were members of clubs and they met together. But over time, that had decreased hugely, and individuals, or maybe not just solely by themselves, but in smaller groups, but not formal groups, not clubs, were doing their bowling outside of clubs, but still bowling was popular. And his interpretation of this as a political scientist was actually there's a lot more going on than, it's not just about bowling. There's some trends in American society that were leading to less participation, less engagement in civic events, less engagement in political activity, and so on. Now the question is, you know, by measuring these things, are we, how confident are we that we're capturing this thing called social capital? I guess what I should say is, I probably should have said at the outset, why on earth do we worry about this? And to some extent we'll come to this on Monday's lecture. There's a view that the amount of social capital could have important effects, more social capital, generally beneficial effects, less social capital, possibly harmful effects on people's health, but not just health, on how well the economy works, and all sorts of aspects of life. Because we are social animals, we don't exist, well, we exist as individuals, but we are working together to some extent, we are cooperating. And the more cooperation we've got, the more we're willing and able to trust in each other, the more we can achieve. Whether that be with respect to people's health, or that just be with respect to economic development. I should maybe say that at the outset, but we'll come back to that on Monday. So what do you think? Do you feel that there is something Well, there's obviously something called social capital because people write about it. And so it exists. But do you feel it doesn't exist because people write about it? It is there. I'm expecting lots of yeses. Don't you think it exists? Do you think it's a sort of figment of sociologists, political scientists, psychologists, economists' imagination?
I have a small comment. Yes, I believe it exists, but I don't think that what is going on right now for measurement is enough.
Mm-hmm.
I mean, when we think about measurement, it means quantifying, like numbers.
Mm-hmm.
And these kind of questions are quite vague. So, but I think the impact on other measurable outcomes can be measured. So I'm looking forward to Monday's lecture.
Right, that's an interesting statement. So this is not particularly measurable, but the impact is measurable. But in order to associate the impact with the social capital, don't you have to be able to measure the social capital?
At least for now, I think it's not enough. I don't know.
Okay, yeah. Please.
Is there a way of validating the measurement, the tools which are being used?
Well, there's various things you could do. If you believe these are tapping into something called social capital, one might imagine that they should tend to move together, up or down. Not absolutely systematically all together, but it would be strange if some things are going up and some things are going down because you're saying these are part of social capital. So it might be as evidence, it's a sort of, some sort of validation. You would expect correlations and maybe the changes in these measures to be correlated, to tend to go in the same direction. I think that might be fair enough. The other thing you could do, and this again anticipating a bit about Monday, is you could say, right, I'll say this is a measure of social capital. I'll look at to what extent it seems to be related to other things, such as health outcomes, and I'll control for other things. So I'll try and isolate the effect of this thing called social capital. And if you then could have hypotheses, we don't expect more social capital to damage people's health. You're tired from going to so many meetings. I don't think so. So that would be another way of doing it. So one, you could kind of look at to what extent these measures move together, and another, you could try and relate these measures to some other outcome, and for us, the most interesting outcomes are probably in terms of health. And you'd be looking for some evidence that higher levels of social capital are associated with better health outcomes.
I think I've answered some questionnaires having these questions, and I didn't know why I was being asked this kind of question, so now I understand.
Ah, right. Why was somebody asking you? Why are you asking this? Yeah. Well, yeah.
I thought some of the questions were not about specific or difficult to answer.
Mm-hmm. Yeah. That's probably why you're being asked them. Yeah. Other views? Yes.
It's my first time the idea of social capital in health economics is today is I first hear this conception, and what comes to my mind is that social capital is some kind of resources. So some resource and the capital, the social capital and the economics is using the economic tool to evaluate or to evaluating the impact of social capital in health areas. Maybe I don't know what the social capital and the economics combined will, what kind of effect will come on. But this is my ideas.
Okay, right. Well, I'll introduce some of the evidence from the economic perspective on Monday. It's actually the case that some economists have been quite critical of calling whatever this is social capital, because capital has, traditional view of capital in economics is things like factories and machines and maybe technology as capital, resource that can then be utilised with other functions. There is also, for a number of years in economics, the idea of human capital, and that's where we begin to look at the individual, I think quite wrongly, but look at the individual essentially as a machine. And when the machine's broken, or the individual's ill, if we can mend the machine or cure the individual, the machine can work again, and so can the individual. We return them to productivity. Now, that sort of way of thinking was never very popular in economics, but over the years has got less popular. Although having said that, it's a human capital notion that largely lies behind the notion of a DALY, Disability Adjusted Life Year. Or originally it was very much based on a human capital notion. The DALY had an age weighting, so that at a very young age essentially had no weight. The weight attached to disability or preventing disability rose as people got to their more productive years. They got to an age where they had more people dependent on them, either younger or older people, and then the weight began to fall again as they got older. So the DALY originally came from very much a human capital notion, but the rest of economics has largely doesn't really embrace human capital as a good analogy. But some economists would argue, and social capital is something else altogether, and it's nothing to do with capital. And so it's not a useful analogy, they would say. So maybe you're seeing the word capital and then feeling, how does this fit in? But that's the word we've got. This is what happens. You get a term for something, and then it's very difficult to move away from that term, because that's the language that everyone's using. To what extent do you think these sorts of elements, sorts of things I've outlined, things like trust and so on, and participation in organisations, to what extent do you think it does measure, let's call it social capital, it measures this thing? Yes?
Thank you, Professor. I think it's a very interesting topic. And actually, I guess social capital is quite versatile in different countries with different social culture and different environments. So I guess that what have learned today, we may have a basic principle. We measure it from the individual level, community level, even national level. So I find it's very interesting. I'm considering how to measure it in China.
Mm-hmm.
Yes. And also, I just get social capital. This word is quite, maybe we are talking about some general social capital. And maybe we have some social capital related to health, social capital related to education, even science. So maybe in different items, I guess. I'm looking forward to the
Right,
lectures.
I see. So that raises a very interesting possibility. We could have something called social capital, which has impact in different areas. One area of impact be it might affect health outcomes.
Yes.
But what you also raise is the possibility that there isn't just one type of social capital, and the social capital that's relevant for health
Yes.
might be different from the social capital that's relevant for education.
Yes, maybe.
That's true. I mean, for example, just thinking on my feet, for education, one of the most important things, I guess, is almost belief in the future. Because why invest in yourself? You know, why make the sacrifices now to gain more education? Well, economists sometimes call education an investment good and a consumption good. So you could just do more education because you enjoy it. But there's a strong investment motive, I think, for most individuals, that you are having, just rubbish the notion of human capital, you are building up your capital stock with more education. The real benefit, a large part of the benefit, will only be in the future, the opportunities it gives you in the future. Now, so in order to encourage individuals to take up more education, you want to make the future look more assured or more available to them. Now that might be different from health. Maybe the payback in health is more immediate, and there's reasons. We don't have to just believe in a future. We just know we want to be healthy. So there might be a difference there. That's interesting. I don't think I've really come across that in the literature. They do tend to try and. Well, the thing is, the people who believe in it want to write about it as if it is this unifying concept. And then the people who don't believe in it probably don't write about it very much. Now, I think there's an interesting question. Are there not just different types of social capital in the sense of individual, community, cognitive, structural, but are there different types of social capital in different sectors of the economy? It's interesting. Any more comments? Questions? Well, let me just give you a sense of where this goes now. So on Monday morning, I'm going to talk about some of the health economic evidence and studies. Essentially, they've used some of these measures and then have tried to relate these measures to changes in health. And a key feature for health economists and indeed economists is the issue of causality. To what extent does a change in one thing cause a change elsewhere? So to what extent does some change in social capital cause a change in health? And the argument that health economists would make is they've been particularly concerned about that, whereas quite a large part of the social capital literature has been more looking at associations. And as you'll know, when you do any sort of empirical work, there's a very big difference between an association and a relationship which is causal. And it's extremely difficult to establish causal relationships. But of course, they're the ones that matter. If we then come to think about policy and think about what sort of changes we might implement, you implement a change, you introduce a policy because you anticipate it's going to have an effect, because you think it has a causal relationship. So for example, you might introduce policies which encourage the growth of social capital. And you're doing that because you think social capital increasing will cause other beneficial outcomes, for example, improved health outcomes. So this association causality aspect is really important, and so I'll be talking a bit about that on Monday. Okay, well, is it legitimate to stop at this point? I don't want to shortchange you, but it's quite warm now, isn't it? And I do appreciate that while you've all got good command of English, it's always difficult to listen to a new voice, and it's just difficult to listen to anybody for an hour and a half, whatever language they're talking. So congratulations to you for surviving. Now, enjoy your weekend, and I hope to see you on Monday. Please. Thank you.